Hello everybody, how are you tonight? So I wanted to get on here and I guess answer some questions about my medical coding course. So I have a lot of inboxes, a lot of emails, of course, all those things. And it's always good to read my posts and what I'm saying about the class and all these things, but I guess it's different in seeing it in a video and hearing what I am saying about the course. So I just want to come on here and answer some general questions that I know people usually or typically have when they're asking me about the medical coding course. So the first thing I want to talk about and the first thing I want to say is, wait a minute, let me turn my air on. So the first thing I want to say, or the first thing I want to talk about, again, I'm talking about the medical coding course that I offer. A lot of people are asking me questions about it. So I wanted to answer questions in a video versus having you guys read the posts that I'm posting on my pages. Just in case it's not private, everybody can't see it. So I can just have a generalized video about what to expect or, what my class offers or how it can be beneficial. So the first thing I want to say about the class is when I say that I am a medical coding instructor or I am a coder, a lot of people, the first thing they say is, oh, I didn't know that you do billing and coding. I don't. I know how to bill, but I am not a biller. I don't bill. So it's two different things. Although it's simultaneously and billing and coding does go together, those are two separate jobs, two separate certifications. And when you're entering these medical coding programs, like Concord or Remington and things like that, now no shot to Concord, Remington, or anything like that. But what I am saying is you have to make sure that you have all of the information before you're signing up for these classes, before you spend your time and you're spending your money, and it might not be the course that employers are looking for. I have a lot of students have come to me and say, hey, I went to Concord, I went for billing and coding, but I can't find a job. Nobody's looking for this certification. So if you're looking into getting into medical coding, there's one question that you can ask across the board, no matter what school you're thinking about going to, no matter what program you're thinking about going to. If you're looking into coding, to make sure that you're taking the right program, there's one question that you can ask that can kill the whole thing about if this is the right program or not. Ask the school or the program, does this program prepare me for a certification through the AAPC, which is the American Academy of Professional Coders, or AHIMA, A-H-I-M-A. If the answer is no, then it's not the program for you. You're wasting your time and you're wasting your money, because the certifications, any other certifications for billing or coding outside of the AAPC or AHIMA, it's not what employers are looking for. Also understand that billing and coding are two separate jobs, two separate things. Billing deals with insurance, co-pays, pre-authorizations before you have any procedures or surgeries to make sure it's covered, patient accounts, deductibles, make sure the patient is paying, talking on the phone to insurance companies to see why the insurance company didn't send the money to your medical office for this specific patient. That's what billing is. Coding deals more with documentation and medical records of reading. Every time you go to the doctor's going to write what's wrong with you. Oh, 25-year-old female comes in, she's coughing and sneezing, we're going to give her a COVID test. So my job as a coder is to read through the documentation and pick out the codes. Everything that a physician or provider diagnose you with, there is a code for it. If they diagnose you with something, there's a code for it. So as coders, what we do is we go through the medical documentation and we look for the diagnoses. And when we see the diagnosis, there is a code that go along with it. That code is money. It's reimbursement. When we use these codes and send the claim out to the insurance company, the biller of course does that, then they're going to know exactly how much money to send this provider, to send this doctor's office for seeing you. That's what coders do. We mostly read documentation, apply the correct codes. Billing is on the phone with insurance companies, making sure these surgeries and procedures are paid for by the insurance company. If a patient owe a bill to the hospital or owe a bill to the medical practice or to the doctor's office, the biller deals with that. So that's the difference between billing and coding. For me, the reason I don't like billing or don't do billing, I didn't get into my job to be on the phone talking to somebody all day. So I don't do billing, or I don't want to do billing because I don't want to be on the phone with insurance companies all day. Coding, you do not have to be on the phone, and it's from home. 98% of the coding jobs are from home because there's nothing that you need in the office. So again, when you're getting into these programs at these trade schools like Concord, Remington, things like that, it is a great start. Do not get me wrong, it's a great start, but understand those certifications sometimes are not where the big bucks are. You can make decent money, don't get me wrong, but if you're looking for big bucks and you're looking into coding or billing, then it's through the AAPC or a HEMA. So let me talk more about my program, since I said a lot of people were asking me questions and I wanted to get over here and make a general video so everybody can get their questions asked about my program. So the number one question that a lot of people ask me, is your program in person or is it virtual, or how does it work? So it is a 12-week program. So when I first started teaching or first started instructing about 2 or 3 years ago, it was a 10-week program. Now it's a 12-week program because I am constantly looking for ways to improve the students' experience when it comes to learning and making sure they're understanding the material to be thoroughly prepared to pass the national exam. So, 12-week program, there are 9 different topics that we cover in those 12 weeks. 9 different topics. So that's 9 weeks. Each week, you're to be hitting a different chapter. I don't care what you're doing in your life, whether you got a job, whether you got a family, whether you got children, you can do 1 chapter a week and it not be stressing. It's not stressful for you. So there are 9 different chapters to my course. So with the 9 chapters, I have also a midterm. I have a midterm, and then I have a final exam, and then we have a complete overview of everything you learned in my class. So that makes it 12 weeks. 9 plus 3 is 12. So 9 weeks of course material. Midway through it, you're going to have a midterm. At the end of the last chapter, after the last chapter, you're going to have a final exam. And then we're going to have a complete overview of everything you learned in the course to prepare you for the exam. So, how does it work, Marciana? So, it is both virtual and online. So, how it works is I meet with you guys once a month. So, the course is 3 months. 12 weeks, 4 times 3, 3 months. So, in those 3 months, the first time we meet, I go over the first 3 chapters. So when I go over the first 3 chapters, then you are to go on your own and complete chapters 1, 2, 3. And then we'll meet again the next month, because that's 3 weeks, 4 weeks. So we'll meet again the next month. We'll go over chapters 4, 5, and 6. And then we'll meet the last month and go over the final 3 chapters, which are 7, 8, and 9. So this course, starting January 2023, I have incorporated something new that I know that will help all of my students even prepare more for the exam. Because I was thinking, if I did not have this first, if I did not have this at first, and I have lots and lots of students, you see the success stories, so I have a lot of students passing the exam. So, and I was figuring if I can incorporate something else, that'll just increase my passing rate even more. So starting January 2023, what I have new that I did not have prior was weekly tutoring sessions. So in between, when you're working on your weekly chapter, every week, once a week, there is a tutoring session that you can join. It's at your discretion if you want to, if you feel like it, if you think you need it, but it's there for you to take advantage of. So every week there is a tutoring session to go over the chapter that you went over for that week. So you're going to get an explanation from me. You're going to have videos. You're going to have handouts. You're going to have study guides. You can download. You can print it. All of those things. And then you're going to also have a weekly tutor to go over all of those things with you. So the price of the program, if you're going to pay total, the total price is $850. So if you're going to get on the payment plan, then it's $900 for the payment plan, which is $300 a month for 3 months. So it's $850 if you pay total. If you get on the payment plan, it's going to be $900 with 3 payments of $300 a month. The book is not included. You can purchase the book directly from the AAPC because I am teaching an AAPC certification. So you can either get the book directly from the AAPC or you can get it on Amazon. So that's one thing that sold me when I got into medical coding. The 3 things that sold me. My class, when I took it, it was 16 weeks. That's 4 months. So my mind, I took about a week to research to see if this is something that I would like to do. So once I realized that, yeah, this is something I like to do, and this is what sold me. I was like, you mean to tell me I can finish this course in 16 weeks, which is a short period of time. I can make decent money when I'm finished and gain my certification, and I can use the book for the exam. So it's like, I already think I'm smart. So I'm like, oh, you know, in addition to the knowledge I already have, I can actually bring my book into this exam and take it. Yes, you can even write notes in your book. Coding is very extensive. There is a code for everything, and codes are constantly updating every year. For example, now we have COVID-19. Well, before 2019, we had never heard of COVID. So, of course, when the 2020 coding books came out, COVID-19 was added to the coding book as a new diagnosis. So there's constantly updates, deletions, revisions when it comes to coding. So they do not expect us to remember all of these things. Just keep it in our memory. So you can use your book for the exam. So it's a short program. The job is in high demand. You're going to make very, 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 very good money. And you can use your book. So for me, it was a no-brainer. There's also levels to coding. You just don't, you can get into coding as an introduction, but there are also, just like it's levels to everything else, it's levels to coding. I started off as a coder, coding medical charts. Well, right now on my job, I am not a coder. Now, I am a physician coding educator where I educate doctors, physicians, practitioners, and I also do auditing. Auditing is when I go behind other coders to see if the codes they use are right or wrong. So I don't actually do any coding myself anymore. I'll look at charts and I say, okay, this coding, you need to fix it. This is wrong. Or great job, this is right. So just like anything else, there are levels to it. So of course, another question people ask me, well, can I find a job once I get certified? I hear a lot of people say that they've been had their certification for 2 years and they have not found a job. You can go on Indeed right now, type in CRC, type in risk adjustment or HCC coding, type in remote as the location, and you're going to see thousands of jobs pop up. So now this is not to take away from anybody. When someone tells me, well, I've been certified for a year or 2 years and I have not found a job yet, there are so many variables that I have to take into consideration. Because I know when I first started and I was in my class, a lot of people told me I wouldn't take that class if it was you. I hear people can't find a job once they're certified. I know a lot of people. So what if I had to listen to those people that was telling me that this isn't a good career, or I'm not going to be able to find a job once I'm certified? So when I hear somebody say, well, I've been certified a year, I've been certified 2 years, and I cannot find a job, my first thing is, well, how does your resume look? Because there is no more face-to-face. Back in the day, we can walk into an establishment, ask for the manager or ask for an application, and we can almost get hired on the spot. So there is no more face-to-face anymore. So your resume is your first impression. So the first thing I'm thinking is, well, how is your resume? oh, my resume is good. I'm getting called back, but when I had an interview, nobody's calling me after the interview. Well, how are your interview skills? So it's a whole long list of things, and you have to do process of elimination when someone says that they've been certified for a long time and they have not found a job, because it's too many coding jobs for a person to be certified for multiple years and not have a job. So one thing I found, and my students can attest to this, my students who have found jobs, once you get your certification in coding and you put your resume out there, you really don't have to look for jobs. It's kind of like the jobs start looking for you, because they see that you have the certification that they're looking for. That's all they're looking for. So if you don't get the job, you have to hone in on your interview skills. You know, maybe it's something about what you said in the interview, or maybe you weren't confident enough. And that's another thing that I teach in my class. And not only do I teach coding, but I teach interview skills. I teach you how to get the job skills, because it's more than just putting your resume out there. You have to know what to say when they're calling you. You have to know what to say when they're interviewing you. You have to do your research and figure out what it is that this specific company is looking for other than your certification. Are you a team player? You know, are you organized? A lot of these things. So when people tell me they've been certified for multiple years and they have not found a job, it's a lot of variation of things that plays in my mind, and it's not because jobs are not available. They're available, and they're looking for people with this certification. So I just wanted to get on here briefly, talk about the medical coding course. My next course is going to be May the 13th through August the 5th. May the 13th through August the 5th. It is now on sale and ready for you to enroll. Registration started on yesterday. So I don't have a deadline as far as when the registration closes. I only accept 60 students. And a lot of times people are like, oh my God, I was trying to get into the class. You know, why do you only take 60 students? I can take 100 students, but will that be conducive to the learning environment? Probably not. I like to give my students a personable experience where I am accessible to answer questions, and if I can't answer, my assistant instructors can. But I do not want to have a class of 100 people and I cannot personally get to know the students who are in my class. So that is the reason why I limit it to 60 people only, because that's the number that's sufficient enough for me to give everybody what they need in the class, and they're able to be successful in my class with this such a small number of just 60. So make sure I don't have any questions before I get off of here. Okay, let's see, because I wanted to come on here and answer any questions that anybody might have, and also just to say anything about the class. Okay, so there are no more questions. Oh, another question a lot of people often ask me is, well, how much is the salary? Excuse me. So a lot of people often ask me about the salary. Well, how much do medical coders generally make? So it depends on your setting, whether you're in the hospital, whether you're in a physician office, whether you're working for a insurance company like United Healthcare, Blue Cross Blue Shield, Aetna, and things like that. So the starting salary of what I see, the starting salary is typically anywhere between like $40,000 to $50,000 starting. Starting is anywhere between $40,000 and $50,000. So $40,000 a year, we know that's $20 an hour. $50,000 a year, we know that's $25 an hour. So anywhere between $20 and $25, if you do not have any experience at all, that's usually the starting place. So that was another thing that was attractive to me that made me get into coding, because for some reason before I started coding, I could not ever really get over that $40,000, $41,000, $42,000 hump. And it's like, is this my life? You know, nothing is wrong with it, but I'm like, I am stuck at $42,000 and this is just not working for me. So what I did was just really was researching things where, what careers could I take that didn't take a lot of time? What career path could I take that didn't take a lot of time work and make great money? So again, the starting salary for medical coding is usually anywhere between $40,000 to $50,000. So if you're starting at that range, imagine the more experience that you get, the higher your salary can be. Again, and I always say, because people know me in real life, so you know, I always say it. So when I first started coding, I was making probably like $23.50 an hour. And that was before I was certified. So that really gave me the drive, being that if I can make $23.50 and I'm not certified, how much can I make once I get my certification? Because I was only $1.50 away from $50,000, and I had been working all my life and couldn't get over the $40,000 hump. And I was like, wow, just by taking a class, now I'm making $48,000 just by taking a class. That's $8,000 more I've been making my whole life. So there is a lot of good money in coding, especially when you get to physician education, when you get to auditing and things like that. Then now you're talking about like in the six figures, anywhere between 60 plus, 60, 70, 80, 90, you know, $100,000 for coding. And a lot of people tell me, well, I didn't know coders make that much money. You have to think about it. We as coders are responsible for making sure that the providers get their money. They don't want to see all these patients and then they're not getting paid for seeing these patients because the wrong codes are on here, so they're not receiving the money that they should receive. So it just makes sense if me as a coder, if I'm making sure your money is right as the doctor, then you should make sure my money is right because I'm making sure yours is right. So it just makes sense that you can't underpay me or you can't give me a little bitty amount of money because I'm responsible for making sure you receive your money. So a lot of times people ask, well, why do coders make so much money? That's because we're responsible for making sure that the doctors get their money or the providers get their money. So you cannot pay us a little bit amount of money and we're making sure that you get yours. It just doesn't work like that. So that's about my class, May the 13th through August the 5th, $850 if you pay it straight out, $900 if you choose to get on the payment plan with 3 payments of $300 a month, 12-week class. It is online. Everything's online. And then we have live sessions to make sure that you're understanding what you're reading online. So I could have easily put the program or put the class together and say, hey, everything's online, go for it. But I also wanted to incorporate live sessions as well to make sure that people are understanding the course material and not just collecting money. That's why I am so invested in my students, because I really do care about them passing this exam, because there's nothing more rewarding than showing somebody else where the money is. You know, like, hey, you were making this, or, you know, you wasn't satisfied in your career. This is a 12-week class where you can potentially almost double your salary within some years, or within a couple of years or whatever, and it didn't take you a long time to do it. So if you have any questions, you can always call me at 800-977-1550, 800-997-1550, from 9 a.m. Eastern Time, 9 a.m. Eastern Time to 7 p.m. Eastern Time. You can also check it out on the website at alliedhealthprepacademy.com. Again, class registration started on yesterday. I do not have an end date. I just allow people to register until all 60 seats are filled. So another question, hey, how long does it normally take for your seats to fill up? So typically, with me putting on the class yesterday for registration or for enrollment, typically by the end of the month, if not before, then all 60 seats are probably be taken. So if you're interested in taking a course, you can always call me for more information at the 800 number. You can email me, you can inbox me, but understand that there are only 60 seats available. Not 61, not 63. There are only 60 seats available. So once those 60 seats are filled, I cut off the registration, then you're no longer able to register. So, if nothing else, let me make sure nobody's asking any questions. Nope. Nope. Okay, so nobody's asking any questions. You already know, you see receipts on my page all the time. 2 of my favorite success stories. Well, I'm gonna say 2 of my favorite because all of them are. I have a lot of success stories because I can't say. I guess one of my favorites is when this young lady didn't have coding background, and within 3 weeks making $100,000 between 2 jobs. Another young lady worked at Comcast for a while. That she had done Comcast for a nice while. Ended up taking my class and just transitioning into a whole nother career after working at Comcast. So it's different variation of levels that people take this class. There are some people who do not have healthcare background at all who takes this class. And then I have physicians or RNs or nurse practitioners who take this class as well. So the levels of variation, it just depends on what you're coming to take this class for and what you plan on doing with it. Most providers take my class because they want to be able to know about their own money. So I have a lot of doctors and a lot of nurse practitioners that take this class because they not only want to know about treating the patients, but they also want to make sure that they're getting the correct money back too. So the only way that you can know that is if you know how to code or if you know my job. So again, if anybody have any questions, you can drop them on this line, or you can drop them in the comment section, and I'll definitely get back to all the comments. AlliedHealthPrepAcademy.com. You can find me on YouTube, MJ the Coding Coach. You can find me on TikTok, MJ the Coding Coach. You can find me on Instagram, the Coding Coach. The Coding Coach. So you guys have a good night. Bye.